go.
Good morning, my name is Madeline Nordstrom and the self-communication disorder at Chester Research is lupus. A brief overview of lupus is lupus is an autoimmune disease that causes chronic inflammation in the connective tissue. An autoimmune disease is where your immune system attacks healthy tissues in your body. The attacks on the tissues is what causes the inflammation. The inflammation is what causes all the symptoms of lupus. To completely understand lupus, you have to look at the pathway at which the communication is affected. Okay, this is a normal T cell and this is a lupus T cell. In the normal T cell, there is two CD3 proteins. In the lupus T cell, there is only one. So it replaces the other one with an FCR protein, and that connects with a CYK. And that connection is so strong it causes an influx of calcium. And then the IL-2 is decreases. This causes the T cell to not work properly, and that's where the communication is disrupted. That makes the overproduction of T cells. Now, what causes lupus? It's a mix of genetics, environmental factors, and hormones. The genes that the mutations occur on are DNA SE1L3 on chromosome 14-3P, which is right here, and then on gene CLR7 on chromosome XP22, which is right here. The environmental factors include sunlight, cigarette smoke, viral infections, and certain medications. These environmental factors can make the lupus worse and also can cause the lupus to start. Next is the hormones. The gene right here, CLR7, is only on the X chromosome. Women have two X chromosomes. That is why researchers believe estrogen has something to do with lupus. Next, who gets lupus? 9 in every 10 patients are women. Their ages 15 to 44, and it's more common in Black and Asian people. This does not mean everyone cannot get lupus. This is just who more commonly gets it. The common symptoms of lupus include migraine headaches, epilepsy, severe mental disorders, joint symptoms such as inflammation and arthritis, long-standing disease, skin rashes. Here are some examples of the skin rashes: raised bumps, thin patches of skin, blisters, ulcers, alopecia, petechia, and sensitivity to sunlight. There are serious complications of lupus. That is inflammation of the kidneys. This affects the body's ability to filter waste from the blood, and it can be so severe that dialysis or a kidney transplant may be needed. Inflammation of the nervous system and brain, which can cause memory problems, confusion, headaches, and strokes. Inflammation of the brain's blood vessels, which can cause high fevers, seizures, and behavioral changes. Hardening of the arteries, also known as coronary artery disease. This is the buildup of deposits on the coronary walls, which can lead to heart attacks. Inflammation of the skin, which causes rashes and ulcers throughout the body. And the rashes and ulcers can cause scarring, and it also causes alopecia. Now, how is lupus diagnosed? Diagnosing lupus is very difficult because you have to look at lab tests, medical history, and family medical history, and those all have to go together to actually diagnose lupus. You can't just have one symptom of lupus to be diagnosed with lupus. There are different types of blood tests that can diagnose lupus. Those are a complete white blood cell count, which counts the white, red, and platelets in your blood, because bleeding under the skin is a symptom of lupus, and that is due to platelet levels. Antibody test, which looks at how the immune system is working. Blood clotting test, because lupus affects clotting. And complement test, because this looks at inflammation in the body, and inflammation is what causes the symptoms in lupus. There are urine tests, and this just looks to see if the kidney's working right, because your kidney is really affected by lupus. There's biopsies, and a biopsy is when a doctor takes tissue and tests it for inflammation. Again, inflammation, a very big deal in lupus. Okay, the types of lupus, there are 4 types of lupus: systemic lupus erythematosus, cutaneous lupus erythematosus, and drug-induced lupus, and neonatal lupus. Systemic lupus erythematosus is the main type of lupus, and generally what everybody thinks of when they hear the word lupus. 70% of people with lupus have SLE. The symptoms are generally all the symptoms I listed earlier and the serious complications. Cutaneous lupus or also known as CLE, is the impacts are confined to the skin, meaning the symptoms are only skin rashes and ulcers. The age difference on this one, you can be 20 to 50. That's when you usually get diagnosed. And if you look over here, I have this MCH complex on human chromosome 6, and that is the gene affected with CLE, and that's why there's a difference in between CLE and SLE. Drug-induced lupus, this is very similar to SLE, but not the major organs are not affected. It can take years or months for the symptoms to occur while taking this medicine, and the symptoms will stop after you stop taking the medicine, but it can take months for them to stop. Neonatal can't technically be called lupus on its own because lupus is an autoimmune disease, meaning your immune system is attacking your tissues, but with neonatal, it's the mother's immune system attacking the fetus. This is because they think it is a threat and they attack it. And just because you have lupus does not mean you're going to get neonatal, and you can get neonatal without having lupus. That is about it on the types of lupus. The treatments are the doctors will look at the treatments, will put the patients on a treatment plan according to the symptoms they have, so the treatment plan varies. The medicines include anticoagulants, which help prevent blood clots, because like I said earlier, that's a symptom of lupus. Anti-inflammatories, which help with inflammation and pain. Again, since inflammation is why all symptoms occur in lupus. Antimalarials, which help protect skin from rashes and UV light. Biologics, which help the patient's immune system work correctly, since lupus is an autoimmune disease. Their immune system does not work correctly. Immunosuppressives, which helps the patient's immune system from attacking his or her body. They only put patients on immunosuppressives when the lupus is very severe, because immunosuppressives basically stop your immune system from working. So if you go out into public, you can get any illness very easily. So that's only for very severe cases of lupus. Steroids help with inflammation. Again, like I said, inflammation is very big in lupus. Okay, now the awareness, it's May, so this is the perfect time for me to be doing my presentation because Lupus Awareness Month is May. And then the color is purple, if you couldn't tell. And then the butterfly is the symbol of lupus, also, if you couldn't tell. If you see right here, Selena Gomez, she has lupus, and she's one of the reasons why I chose to do lupus, because I saw how lupus was seriously affecting her health, and I wanted to learn about all the symptoms and why. Right here, figure 1, this is basically the same as my pathway. Here, I can go back to it. But it's a little bit simpler because this has a lot of stuff on it. So if you look on my board right here, it's a simpler, you can see where the calcium goes up and the IL-2 goes down, and how it affects the T cells up there. And then this picture right here is a picture of a cell going into apoptosis, because when the cell goes into apoptosis, that is when the T cells go and attack the anti-nuclear antibodies, which is basically the dead cell, and the overproduction of the T cells is what causes the communication error. And then, actually, that's about it. So, very good.